The bottom line is we want to assure the American people that we're prepared. We know what it takes. And as this group of bipartisan governors has shown, we're going to get through it by working together.
That was President Joe Biden today during a COVID response call with the National Governors Association, reassuring the American people that amid soaring case counts due to the new Omicron variant, in many parts of the country, cases are outpacing the winter 2020 peak. While cases appear at this point to be less severe, the variant does seem to be much more contagious, and it's having ripple effects all across this country. Today, airlines have canceled more than 900 flights in the U.S. They say mainly because of employees who tested positive for coronavirus. And the CDC is changing its quarantine protocols for healthcare workers who have tested positive, shortening the isolation period from 10 days, which it is now, to 7 days. In a statement, they say this: that isolation time can be cut further if there are staffing shortages. Dr. Anthony Fauci telling our friends on Morning Joe that easing quarantine guidance for the general population is also, quote, under consideration. Joining us now is Dr. Anne Rimoin, professor of epidemiology at UCLA's Fielding School of Public Health. Also MSNBC contributor Jason Johnson, professor of journalism and politics at Morgan State University. Claire's still with us. Okay, Dr. Rimoin, I have a million questions, so everybody settle in. 7 days or 10 days is 7 days or 10 days, and there's no one more important or precious at this hour than our healthcare workers. So if it's good enough for them, why isn't it good enough for everybody?
Well, Nicole, that's an excellent question. And here's the thing. What we're trying to do is not let great be the enemy of good. Who do we need to protect most? We need to protect our health workers, but we have to protect our health system. So we need to be able to, practically speaking, get people back in as soon as we possibly can. If we have a tsunami of cases as we're having right now, and health workers are testing positive, we're going to run into big trouble here if we have people not able to come back in. So this is being very practical. I believe that we will then move forward to have other people as well be able to benefit from this kind of reduced strategy. It's going to incentivize people to get tested. It's going to make a big difference in terms of getting people out of the transmission cycle and back in if we can keep it short. So I think it will be coming. I think we have to start where we can right now, and then we'll move forward as we see that this works.
Can I just be super blunt? Is everyone going to get it? Everyone I know has COVID right now.
Nicole, everybody is not necessarily going to get it. We have the tools to be able to prevent people from getting it, and we should do everything we can to avoid getting it.
I've used all those tools. I'm triple vaxxed. I wear a mask everywhere except when I sit down, and I put it on before I get up. And I'm going to get it. So how do you not get it? How do you not get Omicron?
Nicole, that's very fatalistic. I know how you feel. I understand. I think what we want to do is we really want to avoid getting it right now, because if we can stop the amount of transmission, we're going to be able to protect our health system. The masks make a very big difference. I would wear a very high quality KN95 mask. I think that will make a very big difference in terms of this. I think avoiding places that are very crowded are going to work. We know what actually works. It's not inevitable. Of course, boosting is going to be the thing, and vaccinations are going to really keep people out of it. But I understand your frustration. I understand how everybody feels. It is not inevitable. We should do what we can to avoid getting it, and understand if we've done everything we can, the likelihood is we're going to have a more mild version, and that's much better than we were before. So totally understood. I get where you feel, how you feel. So does the rest of the country. But there are things we can do to minimize it.
I don't feel frustrated. I actually feel relieved. It seems like this is, if you're going to get one of them, this is the one to get. Omicron, I've got 3 shots in 9 months, and I wear my mask everywhere. So if I'm going to get one, I want this one, not the next one. But I want to ask what the goal is, because Vin Gupta comes on this show and says we're counting the wrong thing. We shouldn't be counting cases anymore. We should be looking at hospitalizations and deaths. Do you agree with him?
Well, I absolutely agree. The metric that we need to worry about is the hospitalizations, because when our hospitals get overwhelmed, then everything goes haywire. If you have a stroke, if you have a heart attack, if you have an appendicitis, if you have a car accident, if you need care, that suffers as well. Nothing happens in a vacuum. But I'm going to say that again, nothing happens in a vacuum. And so what that means is that how do we protect our health system? How do we make sure that we really keep our essential infrastructure from breaking down? Well, we do what we can to avoid having more cases, because even if Omicron is less severe than Delta or the other variants that we've seen before, when you have still a percentage of people who are going to need hospitalization and may die, that number increases exponentially, as does the number of cases. So, our bottom line is we just want to be able to protect the health system. The number of cases isn't the most important thing, but how do we prevent those hospitalizations? By reducing cases.
Yeah, I mean, Jason, you see how difficult this is for this administration. I mean, I'm a Fauci groupie. I'm a thrice vaccinated mask adherent. I buy KN95 masks by the, caseload. They're in every pocket. I wear them everywhere except when I sit down. And I am certain that this is not a variant I can outrun. And I wonder where you think the sort of conversation is heading at this moment, Jason.
It's what you were saying, Nicole. It is sort of a fatalism or a nihilism, as the other guest described. This Saturday, right? It's Christmas. I'm hanging out with friends and having dinner, very, very small environments. And when I was texting people to say Merry Christmas, the most common response I got back was, "Oh yeah, and I got COVID. I'm not with my family because I'm sick." I know 7 people who have gotten COVID in the last 10 days. Right? And all of these people are vaccinated, and most of them are boosted. So there's a real sense out there now. People are like, my goodness, the same things that I've been doing to be careful that have kept me safe for a year and a half are no longer working. So if the conversation moves to a place of, well, if we're all going to get it, can we just make sure it's not fatal? I mean, that may, in a political way, perhaps help what's being done now. But what concerns me, quite frankly, and the reason that I am still extra paranoid and vigilant about this and concerned about getting on planes is, as many doctors have said, we don't have longitudinal data on COVID yet. We don't know how this affects you when you turn 50 and 60 and 70. We don't know what the impact is. And that is the thing that concerns me. I worry that if people start thinking that this is the same thing as chickenpox when we were kids, just play with your brother, you'll both get chickenpox and you'll be immune. If we start kind of having that attitude, that we may find out that there's long-term health consequences to this that our medical system really is unprepared for.
Yeah, and Claire, I don't think anyone is suggesting that anyone tried to get COVID, but I think that the polling suggests that vaccinated Americans are more scared of getting COVID than unvaccinated Americans. The rupture is so complete that the people who carry around multiple masks in their pockets, have had 3 shots already, have vaccinated kids under 10, are scared out of their freaking minds, and the unvaccinated are just sort of humming along till they end up on a ventilator. What do you do as a politician at this moment?
Well, first of all, I think this one is a little bit of a challenge in that it is so contagious, but it appears not to be as dangerous. And it does appear a whole lot of folks are getting breakthrough COVID and with the Omicron variant. I have 2 things I want to say. One, if you're vaccinated and boosted and you're exposed to someone, it's my understanding, and this is where it gets confusing, that you do not have to quarantine. Okay, secondly, here is my biggest point I want to make today. The failure of America to have free, available, rapid tests is really being shown right now.
Yeah.
I can't buy tests where I am. If you were in Europe, you can get a test on every street corner, and it's cheap. Yeah. What happened? Who dropped the ball on rapid, cheap tests for America? Because if you're going to have something this virulent, if you're going to have something this contagious, then you need to know if you've got it, because that's the only time you're supposed to quarantine, if you've been vaxxed and boosted. So I'm frustrated because I want to be able to test myself, my family, if we're exposed to people, and you can't get them. That is really bad. And I need the Biden administration to step up and fix that today.
Dr. Ramoyne, I'll give you the last word.
Well, I could not agree more with what everybody has just said here. We need testing, and we need boatloads of testing. We need to be swimming in tests. Everybody should be able to test anytime they need to test. We shouldn't be rationing tests, but that's where we are. We should be very, very thoughtful about what we're going to be doing over the next couple of weeks. We don't want to get COVID now because we don't know what's going to happen. What can you do? Just do the best you can. Get vaccinated, get boosted, mind where you are, wear really good masks, and then, you know, everybody will be in a better situation in the next month or so when we start to see these things move forward. But right now, we're still in that middle ground where we need to be careful.